Hello, Next Level community. It's Coach Jen here. So today we are going to be talking about the unpopular topic from Million Dollar Dentistry, mostly in relation to getting off the new patient treadmill. And I know this can be a very scary thing for a lot of dentists and dental practices because we think we need those new patients to have butts in chairs and, they're going to have all this treatment and all of these things. And we need them for our practice, for the wealth and everything else. But today I would like to share a little bit of a different perspective with you and getting off the new patient treadmill, as what we like to call it, and jumping on and playing the game of basically just taking care of the patients that we already have in our practices. So as most of you probably know from a new patient, from the first phone call with the VIP interview, all the way back around to the treatment coordinator and leaving for the day, new patients can take a lot of time and energy. So think about it. When our person up front, Melanie, takes the phone call. She answers that phone call. She explains a little bit about us. She talks to the patient. She gives her, tender love and care, all the things to this patient, answers all the questions, and asks all the questions as well. That takes up quite a bit of time. Then we have our insurance coordinator going through all of the insurance benefits, collecting all of the data, getting the patient into seeing the treatment coordinator then for kind of the pre-work, finding the personal motivator, doing all of the things that they do so well, starting to kind of turn that visit into some trust and empowerment and kind of getting to know a little bit more about that patient before they go back to the clinicians and so on and so forth. So a lot of times, when we do see new patients, what are we getting? We're getting other dentist problem patients typically. Now, sometimes it's because they've just lost their insurance, or their insurance changed, or their dentist no longer accepts their insurance, or maybe their dentist passed away, or whatever the case might be. But a lot of times what we find is that we get the dentist problem patients, those that don't want to pay their bills, those that don't want to, agree to, actually coming in and doing their treatment and in a timely manner, not canceling their appointments, all of the Karens of the world, a lot of those are what we're seeing in our practices. And so it can be very draining and exhausting for everybody. From up front and to the back. And the thing is that they don't trust us. They don't know. They heard about us, from a radio show. They heard about us from another patient in our practice. They heard about us from their insurance company. That's a big one. I feel like when you just hear about us from an insurance company, you aren't getting the full scope of how amazing we are and all the things that we can offer to you. And so they just kind of landed in a pot of gold, if you will, by finding our office on their insurance website. So it is our job with those new patients to gain their trust so that they want to come back. We can get them put into the ReCare system, all of the things. So, we need to remember that, new patients do take a lot of extra effort from start to finish. It's more costly. It can be exhausting. And something that Gary says is that typically a new patient is only going to accept 17% of the treatment prescribed, and we are only going to retain about 38% of them into our ReCare system. That is a very small percentage, especially when you look at all of the cost, all of the time, all of the energy, all of the things that we put into these new patients. So with that being said, we need to figure out how can we make these quote unquote ideal patients? How can we train these patients from the very start what our practice is about, what we will and will not stand for, all of the things. So Typically with that, we want to create that amazing experience, such as like with the Ritz-Carlton. You walk in, it's the warm welcomes, the beautiful, just looking around and all the elegance and the beauty of everything. And then you're greeted with these just amazing, beautiful people, and they make you feel so welcomed. And that's the kind of experience that we want to give to our new patients. We want to create that level of trust with them. We want to let them know that we're different from other offices. Our standard of care is so much higher. The things that we do here is worth coming here. It's worth maybe paying the extra little bit of money, because what we're going to offer you is the Ritz-Carlton of dental practices. We have so much more to offer you than, the Joe Blow practice down the street. And so in doing that and creating that trust and that value with our patients, it can make such a big difference. And they know right off the bat, oh, I'm signing the broken appointment fee. So I know that this practice's philosophy is I have to cancel a reservation within this amount of time, or I have to pay a fee. Oh, they're serious. Like, I better take this a little bit more seriously than my other practice. I can't just cancel a couple minutes before my appointment because I don't want to have to pay these fees, right? And so it already from the get-go just kind of starts to build that trust with them. And patient education is going to be huge. Educating the patients, showing them those intraoral photos when we're going in there and we're doing the full mouth, view of everything. Our clinicians in the back, our treatment coordinators asking them, the questions, what do you do for a living? Tell me about your kids. Tell me about your life. What makes you happy? All of the things. Just start to welcome them, give them that really nice warm welcome, followed up with amazing education. And guys, here's the thing, getting off the new patient treadmill and stepping on the court with our existing patients is huge. We have a huge potential with our existing patients in our practice, right? So, they might at this time not need a whole lot. And we think, oh, we're just getting them through their recare, all these, 6-month visits. That's why we need the new patients. That's where the treatment is. But guys, if we retrain our brains and we reframe the way we think of being more of a proactive dentist office rather than a reactive dental practice, that is huge. Those intraoral photos are huge. It speaks volumes. We have so many patients already in our practice with old amalgams that are failing, large fractures, broken teeth. They need PerioProtect, whitening, Invisalign, all these things, these amazing things that we can offer to our patients because we are a complete health dental practice and we have a higher standard of care than other offices do. We have a whole range of things in our tool belts to really go and be able to better educate our existing patients, which is kind of where that comes in from. We don't need to just have new patients just cycling in and in and in and in and in for all this treatment because, like Gary says, if only 17 of them are going to accept treatment anyways, we're spinning our wheels for only 17% case acceptance when we're looking for 67% case acceptance. So that already tells you right there that we're already falling short. We're kind of falling flat on our faces because we haven't established all of that trust yet just at a first visit. That's what we're trying to do. So again, just getting off that treadmill, getting on the courts and playing ball with our existing patients is going to be huge. But when we do have those new patients, as I was mentioning, creating that one-of-a-kind amazing Ritz-Carlton experience with them, the glitz and the glamour, if you will, of our practice, how we're different, what stands us apart from other practices, our healthy mouth baseline, our intraoral photos, our iTero scanners, our Florida probe, all these amazing, wonderful things and these amazing technologies that we have in our office. This is time to start showcasing those to our new patients and showing them how we're different. We keep up with our technology. We keep up with our education. We have a new responsibility that we have taken on as your dental provider to provide you with the most Ritz-Carlton, state-of-the-art, dental experience. Our goal is to make them want to come back. We want to make them feel so good, so informed, because if we're informing our patients, then they can then make an informed decision about their own health. So that's going to be huge. Educating those patients is going to be huge. Getting their personal motivators, finding what makes them tick, what makes them happy, what do they do in their personal lives, what are the things that they do for work, what's going to motivate them and drive them to be in that 17% case acceptance, and get them back on our recare visit and show them, usually it's kind of starting to build and gain that trust on a first visit. And then at all of their reoccurring visits, we can start to show them, look how beautiful this crown is. See, that was painless. Look how we used this laser treatment on you and you didn't even feel it. Look how perfect this crown looks, and we didn't even have to send it to a lab. We milled it right in our office here. We can really start to gain their trust and that rapport with the patients on all their subsequent visits. But at that first visit, it's going to be so important, starting from the front and going all the way to the back, to get them back in to schedule their treatment. And it's so, so much about making them feel good, trying to give them the warm, fuzzy feelings that most people don't have about dental practices, giving them that state-of-the-art experience that they deserve. So, the patient education, finding their personal motivator. What fears and concerns do you have? Oh, you're scared of the needle. Well, guess what? We have a laser technology here now that, we don't always have to use needles depending on, whatever. You don't even necessarily have to go into it all the way, but just knowing that we have technology here that we might even not have to give you a needle. And we also have amazing clinicians here in the office that numb patients all day long, and they've been doing this for years and years, and they've got really, really great tools up their sleeves. We're going to make you feel as comfortable as possible. Or, oh, you've had a dentist that, did X, Y, and Z. Well, let me tell you how we are different and how we are going to make you want to come back. And we're going to want to make you see us as, a totally different provider for you than maybe what you've experienced in the past. That's really what that first visit is going to be all about. And it's so crucial. And that's how we're going to hook them in. And I think some people think, oh, well, I'm not good at selling stuff, or there's really no selling involved. There's no selling involved. It is simply just, let me be kind and empathetic and show you that I care and give you support around your fears and your anxieties. Let me show you all the things that you've never been shown before, while also showing you that we are going to provide you with the absolute best dental care that you can ever possibly imagine. And we've got a great team that is going to help you achieve all of your goals. How amazing. Those patients are going to want to come back. They're going to want to go tell their family and friends about it. So in terms of getting off the new patient treadmill, Gary does say we should only be seeing about 15 a week, which most dentists are, what? 15? We see 40, 50, 60. They're a huge part of our practice. And unfortunately, a lot of them are like that. But as I've kind of said, it can be very exhausting from front to back, start to finish. And a lot of times, those patients are not going to make the commitment, and they're not going to choose to stay with us for whatever reason. They're problem patients. They want to jump from dentist to dentist. Who's cheaper? Who's, this, that, or the other. So we want to find those ideal patients, and we want to keep them in our recare system. So to do that, that's where we're going to create that value with them. We are going to create that trust with them. We are going to educate them to the best of our ability, because we all know how to do this. We know what we're doing. We know the oral systemic link, all the connections that are going on there. We are the perfect people to help educate these patients. And most patients will see us more than they see their regular medical doctor. So that right there is enough to say, oh my gosh, this is a huge opportunity. There's a huge opportunity here for us to really help these new patients and to create them into being those ideal patients that are going to show up for their appointments. They're going to pay for their treatment. They're going to do that 5% pay-to-day courtesy. They're going to do all the things that we are hoping that they're going to do, because they see the value, because we've created that for them. We've created that value and that trust. And now they are able to see that. And that's huge. And then the education, again, an intraoral photo is going to speak volumes. It's going to speak right to them. You really don't even have to sell, is what some people say. There's no selling involved. You put that intraoral photo up there on the screen, you show them exactly what's going on. That patient is going to look right at that and say, that is in my mouth. show them. That's what the education is huge. Just by you showing them what's going on in their mouth, another dentist may have recommended that same treatment, but that dentist may not have shown them the pictures. They may not have shown them all the fractures and the extent of the decay that's present. And that, you're just one bite away from breaking off that entire tooth. And then we're talking way more treatment, way more money, all the things. So by giving them that proper education, by also following up then with their personal motivator and easing their fears and anxieties, that is going to be huge. So creating those ideal patients from the start, when they first walk in the door, really from that first phone call to when they leave, that's huge. And so, again, just kind of keeping in mind that we don't have to have all these new patients to keep the cash flow going in our practices. We don't need the new patients to be making money. We already have patients that trust us. We already have patients that come in every, 3, 4, 6 months. They know what we offer. They know how amazing we are. They know how great we are. They've told their family and friends. They all come to see us now. Now let's work on that. And again, it's not by selling them anything or telling them that they need something that they don't need. But again, showing them those intraoral photos, being more proactive versus reactive, being able to have that confidence in yourself and in your team and in your doctors to say, this is what I'm seeing. Do you see what I'm seeing? Let me tell you what the consequences are of not having this treatment fixed. That's huge. That is a whole new level for them that they will have probably never even seen, heard of, didn't even know it existed, but you are going to present that to them. So we don't have to have new patients only. Again, we've got tons of patients in our ReCare system that already trust us. Again, they know what we're about. They love what we're about. They are the ideal patients that we already have. So it's easier to focus on them, especially when you're coming from a place of complete health and being able to talk about the extensive bleeding gums and the need for Perio Protect, the crowding and the malocclusion that they have going on, which is, probably leading to their headaches. And it's probably leading to the fact that they keep chipping their teeth over time, and that this is going to end up being a really pricey thing if we don't fix it immediately. Great, we offer Invisalign. Let me tell you about that. There's so many things that we have that we can be sharing with our patients, even down to the salivary testing, the carotid artery scans, all the things. Because we are a complete dental practice, we want to provide them with all of the amazing technology and the amazing services that we have. So if you feel scared and you feel like, well, we have to have the new patients, you don't. And this is a tried and true method. Gary has done the research. He's been out there. He's been doing it. I've been doing it. I was a clinician for over 15 years. It's real. It doesn't have to be a scary thing. It can actually be a very, almost a lightening effect. Take some of that pressure off your shoulders of feeling like you constantly have to be pushing in the new patients and pushing our existing patients to bring in all their family and friends. Like, yes, if they're ideal patients like you, we want that. But otherwise it doesn't need to be, to where we are on that treadmill, just running and running and running and using up all of our energy, when we can get on the court and play ball with the ReCare patients that we already have. So remember, information without implementation has no value. So take this, go out there, get off the treadmill, and get on the court with your existing patients now.